understanding ovarian cancer treatment with clarity and confidence. Namaskar, I am Dr. Nilesh Chordia, surgical oncologist at SSO Cancer Hospital. If you or loved one has been diagnosed with ovarian cancer, I know it can feel like the floor has suddenly dropped beneath your feet. There will be questions, fears and whirlwind of medical terms. So today, let's slow down. Let's sit down like I would with my patient and her family and talk through the ovarian cancer treatment, what it means, what the journey looks like, and most importantly, what are your options are. Think of this as a conversation and not as a lecture. So what does treatment depends on? Now the first thing first, not all ovarian cancers are treated the same way. The treatment plan depends on the stage of the cancer, how far it has spread, the type of the tumor, patient's age, her general condition, and whether they wish to have children in future. So it's not one size fits all. It's more like tailoring a suit you want to fit just right. Let's talk about stages one by one. Stage 1, early stage, that is localized to ovaries. So imagine catching a fire when it's still in one room. That's stage 1. Here we usually perform surgery called a total hysterectomy with bilateral salpingo-oophorectomy, which means we remove uterus, both ovaries and fallopian tubes. If the patient is young and still wants to have children and the tumor is low grade, limited to one ovary, we may consider fertility sparing surgery. That's removing only the affected ovary. Sometimes we also remove nearby lymph nodes, a fatty layer of tissue called omentum, just to be sure the cancer hasn't spread. Chemotherapy may or may not be needed depending upon the tumor grade and risk factors. Then stage 2. Stage 2 is spread within the pelvis, not in the abdomen. So it's like a fire that has reached the next room, but it's still within the house. Surgery still is our first step, but we will need to be little more aggressive. After removing the uterus, ovaries and tubes, we usually follow up with chemotherapy. It's typically 6 cycles of combination of drugs like carboplatin and paclitaxel. If you are thinking that sounds intense, yes, it is, but it's also highly effective when done early. Stage 3 cancer, when this disease has spread to the abdomen or lymph nodes. Here we are dealing with a fire that's spread throughout the house, and here where things get a bit more technical, we aim to do something that's called cytoreductive surgery, which means we remove as much visible tumor as possible. This can involve parts of the intestines, a diaphragm lining, lymph nodes and even the spleen. And in some advanced stage 3 cases, we also offer a procedure called HIPEC, hyperthermic intraperitoneal chemotherapy. This involves bathing the abdominal cavity with warm chemotherapy during the surgery, like a final mop-up to catch any sneaky microscopic cells. Isn't that a bit extreme? You might ask. Yes, but the studies show that if we can remove 90% or more of tumor burden, outcomes improve drastically. And don't worry, we will prepare you thoroughly before any major surgery. Stage 4 cancer, when cancer has spread to the distant organs like liver, lung, and this is the most advanced stage, but it doesn't mean all hope is lost. Here, the cancer has traveled beyond the abdomen. So we may start with neoadjuvant chemotherapy, that is chemo first, surgery later. Chemo first to shrink the tumor and make surgery safer and more effective. So once the tumor responds well, we perform the interval cytoreduction surgery followed by additional chemotherapy. So depending upon tumor type, we may also use targeted therapies like bevacizumab or PRP inhibitor drugs in patients with BRCA mutation.